A lot of the work we've been doing so far in Rare 2030 has been under Work Package 4, which is all around establishing our knowledge base and mapping trends and drivers of change. So all of the partners have been actively involved with us at Newcastle in this work package. But our goal really was to establish the status quo of rare disease activities in European countries. Just realised you can't see that, the thingy on there, that's okay. And to use the status quo to try to look at what sort of policy gaps and needs we might have, but also to look at what trends and what drivers can we foresee. Thank you, Martina. So we wanted to have a really broad basis, so we set up a panel of experts to guide us in this work. So we have 183 members in our panel of experts from 33 countries, and this panel was organized, or self-organized actually, into a number of different subgroups. So we had 8 subgroups, and most of you, nearly everybody, chose to join 3 of those that most interested you. As you can see, the headings of these are very broad because we wanted this project to really cast the net very wide, looking at all aspects of diagnostics, treatment, care, and social support. So what did we do? What did we prepare? We really started working with all of you as our panel around about April, May time. And for each of these 8 subgroups, we generated what we call a knowledge-based summary. So this is intended as a kind of food for thought document. And the idea behind it is that we're all very familiar with what we're doing in our own disease area, but often there's a lot of projects, there's a lot of investment, there are lots of resources that have been created transversely, so across disease areas that could be useful. So it was really all about bringing everyone onto the same level. So how did we create these summaries, these knowledge-based summaries? There are 3 main areas of content. So the first is we used our partner know-how and expertise to try to map existing resources and projects. Then we brought in some data, some new data, that we collect through the resource on the state-of-the-art of rare disease activities in Europe, which Charlotte Rodwell began and which I currently have the pleasure of leading from Newcastle. So this is where we gather information from each of our member states and a couple of other European countries to find out what's happening in rare diseases. So we tried to bring some of that data into these knowledge-based summaries as well. And the third big area of these knowledge-based summaries was basically the literature review. So this was led by the Orphanet team, by Anna and Charlotte and Florent, and they did a huge scanning of all sorts of published literature and grey literature to see what we could already find in print concerning trends and drivers of change for rare diseases. So I wanted you you can't read this, it's fine. I just wanted to give you a reminder for people who haven't come across these so far of what's in these knowledge-based summaries. Incidentally, if you go to the Rare Disease website, don't have to do it now, but if you go under the governance section, there's a page just for the panel of experts, so you can find all 8 of these advanced draft documents. They will change a bit, they're not set in stone, but they're there if you want to use them, so please do use them. So each of them starts off pretty similarly with an introduction to the topic, and they're very broad topics. Initially, we thought we might manage to do these in about 4 or 5 pages. Most of them are actually between 10 pages and 20 pages when you take into account all of the references. And I hope you forgive that, but the idea was to be as comprehensive as we could, and some of these topics, like research, is really pretty huge. So the next section was about the policy perspective. So we wanted to look at how these different topics had been addressed or not in some of what I always call our policy Bible legislation or soft law in Europe. So things like the Cross-Border Healthcare Directive, the Commission Communication of 2008, and the Council Recommendation of 2009. So we highlighted what's already there, because sometimes we have a lot, and it's just a case of implementing it a bit better. For each of our subgroups, we had a few high-level key questions that we wanted to open up discussions. And as you can see, these are really about barriers, they're about gaps in the existing policies, and they're about practical solutions to take things forward and make things better. We very often included tables or charts that tries to summarize in an easy to access way some of the existing outputs and resources that you can find. So this one, for instance, was highlighting some of the Care project resources that specifically promote the application of more holistic and integrated health and social care. Where we do have European recommendations from the expert groups on rare diseases, we quite often use snapshots of these because these are so important, that these documents. Many of you in the room actually were involved in creating these. And very often there are points in there that I forgot that the member states even agreed to and adopted. So we should all be trying to make the most of what we already have in terms of our policy landscape. Then, as I mentioned earlier, we tried to use the state-of-the-art resource data to come up with some sort of graphs and maps and charts to show what's happening across our countries around particular topics. So what's the status quo around newborn screening, national registries, genetic testing in laboratories, and the Orphanet database, of course, was extremely important here as well. And then lastly, we had the sections around the literature review. So you can see, maybe just see, hopefully you've all read some of these already, but Charlotte, Florent, and Anna kind of summarized particular themes or trends that emerged. So this one was around the patients and caregivers' tendency to feel the socioeconomic burden of the disease particularly heavily. And then at the end of it, it has a link to the references that if you scroll down, you can find the papers. It's a nice, easy way in a couple of pages of sort of digesting about 20 or 30 different publications if you're short of time. So that's what we prepared. And between the middle of June and the middle of September, we missed August entirely. Many of you will remember we had a series of very dynamic but quite exhausting, quite close together teleconferences in our subgroups. So we had 18 two-hour teleconferences in total. And on those calls, we did three things, or we tried to. We tried to stimulate some discussion, that's the blue circle, some discussion very broadly on those key topics. So we tried to look for gaps and for barriers and ways to try to address these. Then we started to think in terms of foresight, which is quite a new concept for a lot of us. And we started to look at past trends or major changes that people had identified looking back across the past 20 to 30 years. And then in the second of each call, because each group met twice, in the second calls, we did something which was even more challenging. We started to look towards the future to see what sort of trends do we think for rare diseases are going to be developing and still active in 20 years' time. So a few different things have come out of all of these calls. Not least, I think, actually, is a real sense of renewed vigor and energy and solidarity. It was so nice to be able to talk to so many different people from different stakeholder groups, which is something that I think we've missed a little bit recently. So that was really, at least for me, I found that really valuable. So some of the things that came out, so obviously the knowledge-based summaries themselves, they're not closed documents, so do keep reading them. Keep letting me know which bits should be updated. If you have some new initiatives that we've missed, some really important cross-cutting disease-agnostic tools or recommendations, then you can let me know, and we will be adapting those in the lead up to the ECRD in May. We also have the shared working documents. So these are the Google Docs that our panel members used, especially if they weren't able to join the calls. And some of these are huge. We've got so much debate on there, so many concrete points. I tried to move things around a little bit so that what went together stayed together. But that's the output of all of your expertise and insights. And they're there for you all to access as well. I'm going to go back to the bottom one in a second. So all of the information that we have on those Google Docs, we're not going to just waste that. We're not going to forget about it. Today, we're really focusing on the future trends and the foresight. But as we move more into Christmas and next year, we're really going to go back to looking at all of your concrete points and suggestions around particular topics like next steps for ERNs, newborn screening, centers of expertise, etc. And we'll work together to see if there are actually areas that don't have any sort of recommendations or guidance that we could work on. A dream, I suppose. You've heard today about the report from the European Auditors Court. So we would like to take the opportunity to think ahead to 2023 and think if we were to be involved in helping to stimulate new policy cycles, new frameworks for rare diseases in Europe, what would be the contents? What would be the topics that weren't on the old soft law documents, or maybe that were, but haven't really been implemented fully? So all of this stuff, which is really close to my heart, we're not going to focus on in depth today. We're going to focus on more the future trends, but these things are linked very closely together, and we will be coming back to everything that you've given us at some point in the near future. So the future trends, these have all been consolidated. You came up in your panel of experts with about 101 specific future-facing trends across all of the subgroups. So that was a huge amount of intelligence gathering. And I'm going to let Giovanna tell us a little bit more about foresight and what we've done with all of those trends. And then we're going to do a little interactive exercise all together, which is where we've had a nice morning of letting you all listen and settle in. And now we're going to get you all to work. So I'm going to hand over to Giovanna, who will tell us more about foresight, and then we will set you up with the SparkUp code. Okay.
Hello, good morning, everybody. My name is Giovanna Giuffre. I'm from Isinova, and we are the new, let's say, in the room. And I work on foresight. I'm not a clairvoyant, unfortunately, but we generally help a community and project on organizing a foresight exercise. We are really supporting participants in order to get their system analyzed and also look at the future. So this is an overview. What we would like to do with you today, and what is foresight for, is really looking at uncertainty. That is something we do not feel very comfortable with, and we try not to see, but there is a quest for vision. And to have a vision, you have to look at trade-off and possibility and risk. To do so, we're asking you today, and also in the survey and before, also to analyze trends that are consolidated and we know what will happen, but also those that actually scared us and we actually don't know what will be in 20 years or in 10 years' time. Why we are doing that? Because we would like to build contrasted, plausible future. To do so, to have contrasted future, we have to see two trends that can evolve in different opposite way. So taking an example, demographic is very hardly change in the next 20 years or 10 years time. Medicine innovation maybe will change faster. And what will happen? How we can prepare for those change, for the better and for the worst. So having the worst case scenarios imagined is good, because we can also prepare to react to that. And it's something that generally people tend to avoid, but I think it's also good to have a picture of what we could be. Just a specificity, we are not working on forecasts. We will not have a quantitative model in this project, so there is no extrapolation of what has happened in the past extrapolated in the future. It's all based on participation, and is one of the projects with more participation that I've been working on, and I think is really the strength of this project. So it's based on your expertise, on your insight, on your imagination. And there will be numbers that can be taken from literature review, but based on what you believe is more important and what we should look at. Okay, good. Fourth step that I think were already mentioned by Jan today, just to remind, we have done this horizon scanning. We have looking at change, and in this foresight jargon, they're called with 4 different names. That is just to name kind of change. So trends are kind of change happening now that can be, you believe, are also important in the future. Driver is what is causing change. So life expectancy is growing. So demographic, we are older in the future. We will be probably, hopefully, older in the future. Weak signal are smaller change that are happening at local level that you trust they can be important and they can grow and become mainstream in the future. Wild card, there was a question in the survey, many of you answered, and I think you all know by now, are like with low probability to happen, but they will have high impact. I don't know, I think Brexit was a political level, really a wild card, something that 20 years ago would not be expected. There is no, very little foresight with this, there was disruption of European Union, but something so is really a wild card and is happening, actually, seems so, but maybe not. But after that, when we will analyze, when we will analyze this trend, we need to identify those that you believe are more important for rare disease, at the same time that are more uncertain, unpredictable. We are not sure how they will impact, how will perform, and we have to imagine two opposite directions they can perform. And once that we have this list of trends that are highly important, highly uncertain, we will call them, this is also foresight jargon, critical uncertainty. These are those that the study and the priority should focus on. All the others will be read and understood on that with the lens of the critical uncertainty, those trends more important than uncertain. Also because the one that you believe are more predictable can be kind of imagining the future. So can be extrapolated from the past or can be used to build up business as usual scenarios. So, but we will keep all the trends on the storyline, that is the final aim of the scenarios, but they will read through the lens of those that you believe today on this afternoon discussion more important and more uncertain. After I was mentioned, after that we will build storyline. Scenarios at the end are stories that help you to trigger your imagination and your policy discussion at different level on how the future could look like. And from that, that will be around March, is start the backcasting. We have these 4 different scenarios, stories, how we move towards those scenarios, the story we want to go. How, which are the trade-off, which are the difficulty, which are the actors we should involve, where we have to make alliance, where there are risks. So this is really the final aim, is a process. And it requires some imagination drafting the storyline. Now there's been the analysis time, and this afternoon we'll ask you also some creativity. And finally, with the pathway and the goal and the setting, there will be a lot also of discussion on more near planning. And this is where also Vicky mentioned, we'll come back on all the suggestions made during the teleconference. So we will pick up for drafting the pathway, also the suggestion made at the very beginning of the project. Just to recap, I think you heard that a lot. But we are looking for something that is important. It means that any change or deviation from the trend, from a business as usual, we can extrapolate from the past and put it in the future, will have a visible effect on the outcome. In this case, on rare disease, governance, treatment, cure, diagnosis. So this is an uncertainty that maybe was from the result of the survey, seems that what was less familiar with, who answered, is really what do you believe will happen? How much is predictable, unpredictable? How is difficult to imagine? How to what extent is subject, could this trend could be changed by policy? And for territorial level, we look at European level. So probably we have also to consider what was mentioned before, the European Union as a mandate has not the possibility to make change in all probably the trend considered by the scanning, horizon scanning. This afternoon we'll be also looking at the interdependency between trends that was mentioned this morning. So the trends mentioned are not independent from each other. Some links are visible more than others, and we need to understand first if some can be considered together. If some are very dependent, maybe we can also consider to group them or divide or just spot this relation. We will just look this interdependency in the afternoon with your expertise. Just is a show how a scenario could look like. At the end, we will work on axis. This is different way of representation. So we will build storyline, make some graphic out of it, and these are projects we have been working in. So we can use axis, we can use kind of analysis, looking at the different trends. One is a representation that is called the tree horizon. So if you come up with analysis for trends, then we will use that to build some kind of graphic representation that can support a storyline. Going to the process quickly, because it was already mentioned, we have a literature review on foresight on health and healthcare. There is no foresight on rare disease. So this is the challenge and the opportunity that your contribution will be very valuable on something that is not there yet. So comprehensive. We had a workshop with rarities and especially patients representation. And we have 9 interviews with the research advisory board that were very inspiring, also looking at the different trends. And we have included all of that in our analysis. These were the people that give us our time and their vision to be considered in the trend analysis. Thanks, really. And this is a bit the overall approach. There's been a lot of balancing. So not all health trends on health and healthcare are included in this list. We match was emerging from the teleconference. And so there was a lot of dialogue between Vicky and me, and trying to say, okay, this is important for healthcare, but this is not so relevant for rare disease, how we can phrase, include or not. So the selection of healthcare trends have been with the main aim of matching and giving trends that could be relevant for rare disease community. So let's say, and also you can see that on the way they are presented, that also for that there were some discussion. We started from rare disease because actually we tried to match healthcare with what was relevant from the teleconference for the panel of experts. So this is, let's say, the consequential presentation. What I will do now, and I have, I think, 1 minute, a few minutes, so I will try to give you some, 4 minutes, great. Some story on the future of healthcare. And just since they say that a picture is worth 1,000 words or something, I use some picture and graph. And it's not, I will not go into details, it's just to give you a flavor of what can happen. So we will get older in the future. That is something that we know. That is also, there will be less people in working age than over 65. That is a picture. How healthy we will be as older, that is a question. How family is changing is another question, because we know that there is people that are having children later on, family are changing structure, and there will be more old people, and this will influence the landscape. Also rare disease will work. And there is childless couple, there is family that are different than what we have in the last 20 years. And what we also know that the healthcare system on overall is under strain. There are different projections how the healthcare will change in the future, and there is a lot of effort on finding new delivery model, especially based on the rise of non-communicable disease. To what extent they will be successful on changing a system that need especially new skills, new management, new way of delivery. That is a challenge that the society is doing that will strongly influence also rare disease community. So I think these two are the start of any foresight on healthcare, let's say. And for good and bad, it brings some opportunities because there is a transformation on the moment, and brings some risk, because if this transformation of the healthcare system doesn't happen, there is a risk of raising inequalities. That is broader. There is a societal challenge, and maybe can be one of the reasons behind the rise of nationalism. But we see a lot of paper and foresight on how inequality will be in the future. How will be more similar to United States. We will keep like the European values and welfare system. These graphs are based on the shocking difference between the top level earning and the bottom 50s. And there is really some thought about and uncertainty how inequality will be in the future. This brings along some hurdle and difficulty on accessing healthcare for all. especially related with where the hospitals are, so distance to hospital and waiting time. So how the welfare system will change based on inequality and how this affects all the community, and with those, how to avoid competition, but more collaboration between diseases. That was also mentioned this morning. Another thing that is a good side, you have been pioneers on patients' empowerment. Now it's a trend that is going mainstream. There is a lot of discussion about patients' empowerment. And these graphs are like, which are the steps, is education, self-management, shared decision-making. So what you have done in the last 20 years, probably the society is doing more now. So it's also good what you can teach about mistake to avoid and how can be better. And what facilitate, the trend that is facilitating this change is for sure the technological advance. So now we share, we learn, we use technology and wearable, we use it for right, what we measure. So there is a lot of confusion and there is the risk, the uncertainty is like Facebook. You really use it for having new knowledge, or you use it for losing your time with looking videos that you don't really want to see. And I see the risk also with digital health. If we don't have a strong knowledge, actually we get it wrong and we use it in the wrong way. So, okay, digital health can be a trend in the future, but the uncertainty is who will actually use it for good, for curing, and not for controlling everything that is maybe not relevant. And the other big question, and is related with this trend, is big data. Who will own the data? Who will have these wearables and app? How they will use it not just for my good, but for others? How I can be controlled by the data I give, because I need and I think is important. And there is a lot of, is an exponential growth of health data. But I'm not clear who owns what and sometimes I think it's so difficult that you just give up your data because it's so difficult to understand how you have to protect them. So there is a lot of public effort to do that, but we see that there is Google, Facebook, major company to which I think European Union has to deal, and the power is not always is a question of governance extended. The other things is the artificial intelligence. There is the ecosystem growing. There is much investment. We see will change, but how much will be humans controlling artificial intelligence and not the other way around? If we get the algorithm wrong, or if we there is a, I don't know, some problem with artificial intelligence, will be not be able to do anything anymore because we are so dependent on artificial intelligence. And then there is innovation in medical knowledge and genomics that is so important. These here are some innovation on medical knowledge that were mentioned in a foresight exercise on biotech and health that are very advanced, from human enhancement, implants. So it's also in the fact sheet. And this graph, I look kind of was the one that for me more clear, is the decreasing cost of genomics. So what will that mean? How this evolve? What ethics, legal value, and what societal challenges does it pose, and how it could offer opportunity and risk? And the final one that I think is the strangest, I tried to find something on medical research, a new way of collaboration. And this is an expert pool done by Bohemia study for the European Commission. We ask a very specific statement on the future, and we ask, do you think it will happen? How is relevant for Europe? And there was like 100 statements, and very limited expert could answer to the different statement. And this one was like, educational system in Europe give equal weight to competitive and collaborative learning practice. The idea is, if we need new way of working together at research level, we need new way also of teaching of those that will work at university in the future. How, to what extent is collaboration and not competition teach in different university, how much we believe on that and trust on that. So from this survey that was, there was a strong feeling that was important and have high relevance for Europe. How to do that is a question, and how Europe will be able to answer to this challenge. So this is a bit an overview of what is going on the healthcare sector, and the idea is to offer you the landscape on which the rare disease specific trends can be read.
So thank you very much, Giovanna. I'm just going to give you your back. So, Martina, can I ask you to load up the slide that's going to give us our SparkUp login? So you don't need to download any applications here. You just literally visit, you type this into your browser, and hopefully any browser should work. So that is the address at the bottom. It's the eurodis.sparkup.live. And it'll ask you for a code, which, fingers crossed, will be the one that we have on the screen. Okay, because this is what we're going to do for the rest of the time until lunch. Now, we've mentioned a few times today the big survey, which was done through SurveyMonkey, and about 125 of our panel of experts completed that, which is fantastic. About 50 of you in the room, however, did not complete that. And that might mean that some of you are not as au fait, not as up to date with our list of 12 trends. Now, that's not good, because the afternoon is all about you working and talking and giving us feedback on those 12 overarching trends. So we thought it would be good, even for the people who have done the survey, and I have to say, thank you so much. I know it was quite time consuming. I think lots of you spent a lot of time on it, but I'm guessing that even with the best will in the world, you won't have a clear memory of exactly what kind of specific sub-trends fell underneath those 12, because those 12 headings are actually quite overarching, and it's not always so clear, even to me, what specific things for rare diseases come under each of them. So you might think, where's my comment gone? Where's my future trend? So we're going to do a bit of a run through. Yes. Oh. The code works, but it works. So it works for Anna's. So yeah, the code on the piece of paper is an old code. It won't work. So please use the one on the screen. So the code you need is not the code on your piece of paper. It's this one, which is K for kilo, L for Lima, W for whiskey, O for Oscar, J for Juliet. Okay, is everyone doing that one? Yeah, fantastic. So we're going to do a little run through. So even though many of you have completed this, it would be great if you do it again in the room, because we can kind of take the temperature. And yeah, we will do. If anyone's having any issues, if you put your hand up, and Martina will do a little run around and she will help you out, okay? So in the meantime, this is what we're going to do. For each of these 12, I'm going to give you, with no slides, so please bear with me, a lightning fast summary of some of the specific things that fell under that heading, okay? And I'm going to do that for, depending on the trend, between 2 and 3.5 minutes. This is going to be a wild ride, guys, the rest of the morning. After I do that, I'm going to show you the question on the screen and ask you to vote on the importance and on the unpredictability, the uncertainty. And when we get to the first one, I'll just say 1 or 2 words to remind you of what we mean by those things, because that's really important. Then I'm going to have a little panel here of some of our partners. So if you would like to come and take your seats, that would be fantastic. And what I'm going to do with our 4 or 5 partners is, after you answer each question, so we'll do trend 1 first, I'm going to call upon just 1, maybe 2, depending on time, of our partners, just to give a very brief comment to bring it to life a bit on what they think about the result, how they personally voted or would vote, what might be some of the issues to think about around the predictability of the trends. So our panel, we have Charlotte Brinton from ICL, we have Anna Rath from Orphanet, we have Maurizio Scarpa from the MetaBurn, we have Lucia Monaco from the Telethon Foundation, and we have Anna Cole, who of course you all know from Eurodis. So anybody else struggling with the system, the SparkUp, if you just put your hand in the air, and Martina will come to you. And in the meantime, I'm going to start us off with trend number 1. Okay? Already? Perfect. I'm going to even time myself. Okay. Perfect. So trend number 1, this is around the rise of pan-European multi-stakeholder networks to advance diagnostics, treatment, and care. So actually, this trend is very focused on European reference networks, but it also includes that move towards networking that we see in, for instance, the European Joint Programme for Rare Diseases and some of the research infrastructures. So we tended, when we were putting together these little trend fact sheets, when we were combining these 100 plus trends around these 12 headings, and sometimes they appear more than once, I should say, when we were doing this, we tried to roughly divide them into some opportunities and some risks. So actually, on the ERN side, on this trend 1, a lot of these topics and these sub-trends were quite positive. So our panel said that actually the future for ERNs seems very bright, provided that they continue to get European support and they continue to get strong national level support. ERNs will certainly continue to be important in future. I'm going to read out some of your exact quotes. And their importance will grow as their impact is demonstrated. So there was a particular view that as the ERNs show what they're doing, especially long-term, and show the clinical outcomes for patients, the support will grow and they will increasingly become beacons for investment and support across a range of activities. Another strong advantage, a future trend for ERNs, is that actually as they get more embedded in national health systems, they will be able to disseminate more good practices across the national health systems. The major risk here, to be honest, is that the networks will not receive the required level of support from either the European Commission or from the national authorities. And if this happens, people felt that actually it would be very hard to continue to have people working under their own steam, even with the best of will. They need resources. There was a little bit of a sense that without that in the coming years, the ERNs are really going to be under increasing strain and could even buckle. Another risk actually around the rise of European networking and ERNs in particular is kind of a personnel, a demographic issue. It was recognized by our panel that actually a lot of the ERNs are coordinated by, I'm going to give lots of praise here. No, not even that one. I'm not going to go with the B word for now. They're coordinated by real giants in their field, by clinical leads who have dedicated their lives, day and night, weekends and holidays, to the rare disease cause. And that a lot of these people are growing older and are going to retire eventually. So there's a worry that actually the generation behind might not have such dedicated, passionate trailblazers ready to take up the slack. So that was a concern. So that was a very quick summary of our first trend. So maybe we can see the question on the screen, Martina?
Yeah. I don't know what's not working. It was working.
While she's doing it, I'm going to give you a little bit of guidance on how to answer, or at least what the question means. So you'll be asked 2 questions. The first question is asking you to rank the importance of this trend. Now, what this means is, if there's any change or any deviation from this trend, is it going to have a really big impact on the rare disease field? Now, that could be a positive impact, or it could be a negative impact. But if something changes in this trend, if it doesn't actually come to fruition, if it stops being relevant in 20 years' time, and we're trying to look at that 2040 horizon, does it actually matter? If it doesn't matter, then actually it's not that important and you should rate it as lower importance. If a big impact would come about from any change in this trend not happening or happening differently, then you should rate it as being of high importance. Okay? So coming in. So that's the importance question. And just while they're loading this up, the second question, I think some of you may have struggled with a little bit when you were doing the Survey Monkey. I know I did. This is the question around unpredictability. And I suppose one thing that it took me months to really realize in this project is that for foresight, you're looking for trends which are highly important, but also pretty unpredictable. Because if they're predictable, then our governments, our policymakers, we hope, will know about them already. It's about trying to future-proof. So really, we're looking for the top important trends, but also those which are highly unpredictable. And what we mean by that is, to what extent is the future evolution of this trend predictable, and open to change. So if you're pretty certain that a trend is going to evolve in a certain way, then that's quite predictable. You would therefore rank it as being very predictable. If you really don't know which way it's going to go, if a trend is very much sensitive and open to changes in financial situations, changes in a country's government, changes societally, then you should rank it as being more unpredictable, more uncertain. Is that a little bit clear? Okay. So, okay, perfect. So anyone, okay, so we can vote now. It's catching up with you. It's too late?
It says too late, yes.
Ah, have you closed it?
Sorry.
No, I can't open it again.
It'll get easier, I promise. Okay. So this is our importance question. So we've got 47% of you voted this one as being critically important. Nobody? So who are these people? We will get there. The technology is always good fun to play with. Yeah. Okay, so we'll go for the predictability one. I should say that don't worry, the stats from this we're going to combine with the SurveyMonkey, so we're going to pull it all together, so don't worry. So let's go to the second one. Okay, so you can start voting now. How predictable do you consider the evolution of this trend to be 2030, 2040? Let's aim for 2040 and be ambitious. So 1 is very unpredictable, no idea how it's going to evolve, and 5 is fully predictable. So if you can all vote now. So we've got 119 users potentially. We're obviously not going to wait for everyone. We'll be there all day. Okay, closing in 3, 2, 1. Martina? Yeah.
It's still people voting. Hold on.
That's okay. Yeah. Yeah, we'll never get 100 if we just get it. Okay.
Yeah, no, you have the trend there. You have the trend on the top. Very small, but on the top.
So the trend is written on the top. Can you all see? Look, so the trend is up here. Yeah. Hopefully you can see it better on your own screens than you can see it on these big screens. Yes. Okay, so I shall read out. So, okay, even better.
I'm sorry, everyone.
Solution.
We had a bit of a,
I will read them, but also inside your folders, you all have a colored table, which is a list. Everyone listening? We have a list inside your folders of all 12 trends. So if you just read across, if you can't see if the writing's too small, you've got the master list in there. What I'll also ask you to do actually as we go through is if anything occurs to you from the specific trends that I'm pulling out, jot it down. You've got a little section on the end for comments, because what we're going to do this afternoon is we'll all be quiet and we're going to ask all of you to do the talking for 2 hours in smaller groups. So we're going to go through these in real detail. So jot things down as you're going through, anything that stands out, and also where you see some overlap or complementarity between the different trends. Okay, right, so our result is, the most popular response here is that this is a partially predictable trend. So I am going to, with about 1 minute, invite Maurizio, I think is the best person here, just to make a quick comment on the result and or your own personal preferences and how you voted or would have voted, Maurizio.
Well, thank you very much. I think that to raise the pan-European multi-stakeholder network is really necessary to understand exactly the importance of raising the network of multi-stakeholder. One thing that, for example, for the ERN is now important, since we have done already the structure of the ERN, is indeed to interact with a network of stakeholders, which it is not really, I don't say existing, but it is actually not so completed. The risk that you listed before are all very important regarding the national health system integration, the fact that we don't have young physicians. But what it is also important is if we want really to see the impact of the ERN, we need more collaboration with the stakeholders, so payers, with member states, with companies developing drugs rather than diagnostics. Because the rare diseases world is really changing. It is changing because it is evolving in incidence. We are discovering with newborn screening that rare diseases are not so rare anymore because we have pre-symptomatic diseases. So the creation of a network with all these stakeholders is still ongoing, and it will be the future of success.
Thank you very much, Maurizio, and thank you for being very succinct and to the point. So we're going to go to our second one. Hopefully things will be smoother from now on. The first is always the worst. Okay, our second trend. So again, I'll summarize for a couple of minutes, tell you what's under that heading. And our heading this time is strains on the healthcare budget and the emergence of new care delivery models. Then, guys on the table, I will say open the poll. We'll open it until we get over 80, and then we'll close it. So don't vote yet, okay? So for this trend, actually, I think the title is a little unclear for this one, because really, when you look at the fact sheets, what it's all talking about is mainly the drive towards greater use of integrated, person-centered, holistic approaches to health and social care. So some of the specific trends that people identified here is that we expect more research, these are the positive ones, more research on the social impact and the burden of illness of rare diseases, so better understanding of the real issues facing patients, more understanding and emphasis on health-related quality of life, and on developing and using more appropriate patient-relevant outcomes and measures. Generally, the panel predicted a growing realization that integrated and holistic care can improve the quality of life for people with a rare disease, even where there's no treatment, where there's no medicine. And that's really, really important because that's basically 95% of our conditions. We predict a better diffusion of knowledge on integrated and holistic care, especially through our resource centers. We'll see more, we hope, more case coordinators, more care coordination. And also under this trend, digital health tools like machine support and assistive technologies and apps will hopefully mean that independent living becomes more of a reality for more people with rare diseases. So some of the risks here, actually there weren't so many, it was mainly positives. Some of the risks were that actually some centers feared that because orphan drug prices tend to be so high, if that continues, and this is where we come across with the trends intersecting, if that continues, some centers actually might not be able to afford to put emphasis on the holistic and social and integrated approach. So that was the main risk. And again, there was a slight concern that do we have the personnel in place? Do we have the skills? Do we have enough people trained to be case managers and care coordinators? So, okay, poll open. So thinking about this trend again, how important, looking ahead to 2040, is this trend around strains on the healthcare budget and the emergence of new care delivery models? So keep going. So if you think it's critically important, you vote 1. If you think it's of low importance, go for 5. If you try to avoid 3s, that might be controversial, but sometimes it's tempting just to go 3, 3, 3 all the way through. You let me know when we get to 80?
Yeah. One more second.
Okay. Keep going. And we're closing. 3, 2, 1. Closed. Okay. So 56% voted this one as critically important, 34% is very important, 9% is important, etc. So pretty important. Let's go straight on to our predictability question, or unpredictability as it may be. Okay, how predictable do you consider the evolution of this trend to be when we look ahead to 2040? So again, 1 is unpredictable, 5 is fully predictable. So vote, keep going. Okay, get a few more. And we'll close in 3, 2, 1. Okay, so almost bit of a split. Almost a highest here was mostly predictable. That was 36%, not far behind. 30% we have partially predictable. So a little bit of a mixed split. So I'm going to give this exciting comment to, I think, Anna Rath, to give us your insights on the results and how you would have voted or did vote.
Yeah, thank you, Vicky. Yes, that is very tricky, and I'm a little bit surprised of the predictability result of the vote, because I think that there is a lot of uncertainty in making holistic care really being the commonplace and come to reality. Why? Because of course, in an economic constrained situation, the key is to solve, for me, the proximity of the patient. So to make better use of the health resources. But health here is comprised as a holistic thing, not only health care, but also the social care, paramedical care. And unfortunately, in most countries, these two sectors are not really talking each other. And that is particularly true for rare diseases, because in the healthcare sector, you have a disease focus, and in the other sector, you have manifestations, let's say activity restrictions, participation limitations, focus, and they are not really talking each other. And that is, for me, for that to come to reality is really uncertain, because it needs a specific political voluntary policy to make these two systems talk to each other. And the case management or these new competencies should be trained, and so that there should be a policy to make that happen. So for me, it's extremely important, but highly unpredictable.
Thank you very much, Anna. Okay, let's move to trend number 3. And again, don't forget to jot down all of your comments on the piece of paper. If we had days, then I would open up each one of these for an audience discussion now, but we would never get any lunch. In fact, we'd probably not get any sleep. So we're just going to keep going through. I told you it was going to be a wild ride, so stick with us. Okay, trend number 3. Again, I'll summarize it, and then we'll open the poll, and then we will vote. So trend number 3 is greater variation in access to treatments and care, resulting in more inequality across Europe for people with rare diseases. So for some of these, if you looked at the fact sheet, some of them we do the risks first, some of them are only risks and no opportunities. It depends a little bit on how the trend is entitled. So some of the risks here were that actually the areas that already attract a lot of pharma attention, and there are already quite a lot of orphan medicinal products either out there or in the pipeline, that they will continue to be the focus of R&D, research and development, and therefore we're going to get an increased gap between the disease areas that have some therapeutic options and those that have none. There were a few sort of disaster predictions here that actually the price of the orphan medicinal products, always a hot topic, is going to continue to rise until we have a disaster of sorts, or there's some kind of a critical turning point where patients really, really struggle to access the medicinal products at all. As healthcare resources continue to shrink, and again, I'm reading out your comments, I'm not paraphrasing, these are what you've all come up with. As healthcare resources continue to shrink and society becomes less caring, expensive treatments for rare diseases are less and less likely to be made available. The public support may not always be guaranteed for rarity over other areas of high unmet need. So these are a few of our risks. Some of our opportunities around this area. There were actually quite a lot of opportunities highlighted, believe it or not, around health technology assessment, HTA collaboration. So we've got some positive specific trends here, that there'll be more regional and cross-country collaboration in discussions between HTA bodies and payers even, leading to more accessibility of medicines. That the HTA considerations will be brought in earlier and earlier, so closer to the regulatory discussions. We'll have a greater drive towards performance-based approvals and access models. So actually, people will pay the high cost for medicines that really do what they say on the tin And if your medicine doesn't do that, it won't be made available. And also that we will have growing transparency in the HTA process. We also had a couple of comments here about activities that make, or ultimately would make, orphan medicinal products more affordable. Because the theory there is if you can make the medicines more affordable, you're going to increase the accessibility and reduce the variation that we get today. So a couple of interesting specific trends were the following. Reflections that public money has been used to instigate the R&D development of orphan drugs is not fully taken into account at the moment and should come in more and more. And another was that actually less traditional tech companies are going to enter the rare disease therapy space more and more, which will bring new approaches to bringing drugs to market with the expectations that the prices will be lower. So that again is a lightning fast summary of some of the specific things that you highlighted under this trend number 3. So if we can open the poll, this is greater variation in access to treatments and care, resulting in more inequality across Europe for people with rare diseases. So how important, looking ahead to 2040, how important do you think this trend will be for the rare disease field? And if you can all vote, what are we doing? Got an extra user from somewhere. If you're doing this, if you're joining us online, by the way, then actually it probably works a lot easier for you guys because you're looking at your own screens, but you're very welcome to join as well. Okay, and we'll close in 3, 2, 1. Okay, interesting. So the top answers are critically important and very important, and these both come out equally with 45%. So let's think about the predictability question. So if we can have that on the screen. Okay, so how predictable do you consider the evolution of this trend to be at 2040? Is it going to be really unpredictable, how this is going to evolve, or is it going to be fully predictable, or something in the middle? Again, try to avoid 3s all the time if you can. It'll give us more exciting data to work with. So do keep voting. Give a few more seconds. So we will go 3, 2, 1, and we'll close. Okay, so the most popular answer this time was partially predictable with 40%. 22% of you went for mostly predictable, 20% went for unpredictable, so quite a split. So I'm going to give this exciting comment, not a challenging one at all, to Charlotte on our panel. So Charlotte, do you want to say a little bit about the result or how you personally foresee this trend developing?
Thank you, Vicky. I think it's really interesting. I think we get this bimodal distribution because you ask people not to vote for the 3. Otherwise, we might get a little bit more of a normal distribution. I think this is a really interesting trend. I think we will probably agree that most trends are very important, if not critically important. In terms of the unpredictability, I think that's the major issue here. How predictable is a yes or no? And just, I mean, the trend is about access to treatment, but I just want to take a step back and look at availability of treatment, where obviously we've had the orphan medicinal product regulation, which has been very successful in terms of opening up treatment possibilities for a particular group of rare disease patients, but not for everyone. And that's also currently why it's under review. And I think that that is one of the things that we need to take away from this, is that if there aren't any changes to the current system, then I think that this inequality in access is going to be a pretty predictable trend across Europe, both across member states, but also within member states. So what are the challenges that we then have when it comes to treatment availability and orphan medicinal products? I think that one of the things that we may have to think about is not just the originator product, which is clearly what the current regulation very much incentivizes, but we have to think about the entire life cycle of the product, and also how we might incentivize perhaps intermediate steps towards creating a treatment for rare diseases that are currently not incentivized. In terms of the health technology assessments, I think it's a really good development that people are trying to tie this more closely to the regulatory frameworks, and also trying to regionally collaborate. But then again, one of the challenges that we have there is, unless there is political will to define a solidarity across the whole of Europe, I think it's also going to be pretty unpredictable how this, well, pretty predictable how this inequality, or that this inequality might be increasing. So how can we take this unpredictability away? I think that is by having the political will to define what solidarity is at a European level, not at a member state level. That's probably one of the biggest challenges I see for the HTA.
Thank you very much, Charlotte. And actually this afternoon, that's exactly what we're going to be hoping all of you will be doing, is thinking of some concrete ways that we can address the unpredictability of some of these, and at least envisage very different, black and white futures for some of these trends, very different realities in 2040. Okay, we're going to move on to trend number 4. This is demographic change in rare disease patients is introducing new challenges. Now, the eagle-eyed people who really pored over these fact sheets will realize that we made a little bit of a mistake in this one. We sort of combined lots of things together under risks, which really aren't risks at all, they're opportunities. So that will be amended. But I'm going to summarize briefly what this one is all about. So the basic point here is that more advanced therapies, which are better targeted to individuals' genotypes and phenotypes, so the clinical presentations, and better standards of care, mean that patients with rare diseases, not by any means everyone, but more than was in the past, they are surviving for longer with fewer complications, and that brings about, that demographic shift brings about with it a new range of challenges and opportunities. So some of the opportunities, we envisage a greater understanding of the natural history of the diseases and a stronger emphasis on understanding patients' daily realities. That's going to help us to move towards more tailored, more person-centered care. There was a feeling that actually, as we start to focus on individuals with different life trajectories, we're going to be looking not just at people who have particular symptoms, but actually how we can prevent those symptoms from appearing in the first place. Looking at the emergence of therapies for secondary or accompanying conditions and comorbidities. Care will not only focus on patients, but also increasingly on healthy mutation carriers. We've got other positives that actually more people with rare diseases will be able to live increasingly independent lives, administering their own care. People will be able to make decisions about, for instance, their reproductive future, whereas in the past, frankly, these things were not a possibility because people were not even living into adulthood. So for some of our conditions, there's a really drastic shift in that demographic and in people's entire life path. When we talk about preventative medicine, this is a tricky one. You can have opportunities, again, giving people more informed decision-making in their reproductive health, but obviously that carries with it lots of difficult ethical discussions around the value of human life. So this was a snapshot. It was quite an interesting one, I thought, actually, the demographic change. So let's see what you think. So let's open that one up. So how important is this trend, demographic change of rare disease patients introducing new challenges? How important will this be looking ahead to 2040? So we're open. And we'll close in 3, 2, 1. Okay, so again, pretty important. I think this is a bit of a trend in itself in that rare diseases, and it'll be interesting actually to find out from you, Giovanna, later on, whether you find this in other areas. I think in rare diseases, we do feel that absolutely everything is really, really important. So this is a tricky thing to judge. Okay, so we've got the top answer there is very important, 34%, but actually just under it, 32% went for critically important. So what about the predictability or the uncertainty of this trend? If we go to our second question. Okay. So how predictable do you consider the evolution of this trend to be at 2040? How predictable do you think this is going to be in terms of how it pans out? Keep voting.
Vicky, sorry, I'm going to ask a very naive, stupid question, but maybe
I'm sure it won't be.
When we think about certainty and uncertainty, are we talking about the demographic trends and the needs, or about how the needs are going to be addressed in the next 10 years?
So that's a very good question. So the title of our trend is Demographic Change of Rare Disease Patients Introducing New Challenges. So do we have an idea about what sort of challenges are going to evolve given these demographic changes? Think,
But
Anna?
Giovanna, I don't know if you had something to add. So the question is, are there current policies in place already that let us know that this is sort of taken care of, or are we going to age and is the demographics going to change, or is it a combination?
On the healthcare, you look, are we going to age?
So on the actual,
Answering to the challenge, I think it's already into the policy discussion, but because then is the question, will be the actor able to answer to the challenge in reality?
So do we envisage new
To
challenges?
have a more objective kind of view, or do you think the population will age? And this will be the challenge that should be discussed and in the scenarios.
It's a very good question.
Yes, but sorry, just to push, because I think
Yeah.
that may affect the way we vote.
absolutely,
Yeah.
In general, even for the questions. That from what I understood of the exercise of
Thank you.
on,
Anya.
on the vote here is that what we're looking for is trends which are critically important, but with higher unpredictability, so high uncertainties. So here, typically, if we say that it's the demographic, we're all going to vote in the direction of yes, that's certain, right?
Yeah.
Or almost certain. So that may mean that then the trend is, it's not going to be so important for us, when in fact it is one, because that's a real one which is really changing compared to the 10 or last 20 years. So I'm a bit lost on how to really answer these questions of certainty, uncertainties, and predictability.
But for example, if this trend is ranked, the trends that those trends ranked as very important but predictable will be taken in consideration because they will be the landscape on which the uncertainty trends will move. So for example, we know there will be aging population, how equity, technologies and cost of medicine will play in a situation in which there will be more age population. So they will be taken in consideration, but we know more or less how. So they will create the landscape.
Yeah. That's a really good point, actually. And yeah, thank you for asking that, Jan. It's not that actually, I think, you know, that the foresight process means that if a trend is not highly important and very unpredictable, that it doesn't count and we forget about it. And actually, one of the groups this afternoon will be focusing specifically on this one. So all of these kind of subtleties, which are really important, we need to bring in. So for sure, you know, we know people are going to, society generally, we know we're all going to age, but actually, in terms of the sort of opportunities and challenges for some of our rare conditions where now the outlook is very different than what it was 5 years ago, how confident are we in how that, you know, what opportunities will that really open for them, but also what challenges are they going to face? So we can talk about this one in a bit more depth this afternoon as well. But do please note all of these subtleties because these titles are not set in stone. That's exactly, as I understand it, what foresight is all about. If the titles don't make sense, if they need to be revised, then we can do that. Okay. So I'm going to give, I think, Maurizio. Oh, did we vote? Sorry. So I'll stop. Yep. That was a long vote. Okay. So for this one, we got mostly predictable, but again, it slightly depends. Well, actually, it massively depends on exactly what you're voting on. Are you voting on the fact that we know people are going to have a demographic change, that more and more rare diseases, your outlook is going to change? Or are we voting on how certain we'll be about what those sorts of changes are going to be? So maybe I will ask Maurizio to make a comment on this one, Maurizio.
Well, I give you an example. I'm a pediatrician, and more I'm treating adults. And this is something that it is increasing in the last 10 years. Aging of the population, as we see in the epidemiology, is, in my opinion, not affecting the rare diseases at all. The normal aging. It's the aging of the rare patient which is affecting the attitude of the physician to treat the disease. And we have to divide the aging of the patient not only to the one that are in the 40s, 50s, 60s, 70s, 80s, but also on the severe patients that before what we are able to understand in terms of diagnosis, pathophysiology, natural history, palliative cares or therapies, now they are surviving longer than what usually the original disease was in 10 years ago doing. We have patients that whenever we were the diagnosis, we could predict dying, unfortunately, in the first, second, or third year of age. Now we go to 10th to 11th. And these steps are important, and this is also aging in terms of capability of having diagnosis earlier than the normal. So regarding aging, it's a very wide world, and it will be very important right now to discuss it properly from now on, because it will be really a major challenge. We have indeed patients that are now from the adolescent going to the adulthood. So we have not only problems of understanding properly during the adolescenthood how the disease is changing and how they are different from the peers for age, but it is also important for opportunities of work, sexuality, creating a family, having children, and all these kind of things. And unfortunately, I have to say, they are discarded or released by the pediatric environment where they grow. And then they go to the adult where rare diseases are treated as chronic disorders. And this is another major challenge of the aging. Rare diseases are not chronic disorders. Because a chronic disorder is actually a disease that has reached a certain stage of severity and will last. A rare disease is never a chronic. It's always a progressing independently from the rare disease. So it's the attitude of the physician which is different. And this is also another challenge. Yeah. Another important thing is that there is no common policy in Europe for transition. So there are here and there spots, hospitals where they have a program, looking to the US, developing their own program. We know about very good hospital making transitional, but we don't have it. And indeed, the adult physicians actually, when they see a rare disease, they send it to the Center for Rare Disorders, and most of the time the Center of Rare Disease are made of pediatricians. So I could discuss for a day about that. So I think that here, aging is a term that need to be, just to make a summary, need to be adapted to the single disease and the single severity. And of course, there are comorbidities of the age which are appearing and before the patient did not have it because they were not surviving. And so a lot of additional problems for the patient with rare diseases for the age, diabetes, cancer, hypertension, or whatever that.
Okay. Thank you, Maurizio.
I don't know, but we
could discuss this one forever. Yeah, no, thank you very much. I'm going to accelerate through a few of our others. So trend number 5, this is around threats. That's quite a strong word even there. Threats to solidarity, equity, and the prioritization of rare diseases. This actually brought in several different things. There were some positives here that actually you could argue that the rare disease cause globally is gaining traction, that you have groups like Rare Disease International, you have the IRDIC, you have the Congo Committee for Rare Diseases at the UN, we have the Universal Health Coverage Political Declaration, all these positive things. Our panel specifically said that actually, whereas in the past we focused more on treatments, on cures, increasingly going forwards, people will be focusing more on the abilities and disability side. And as part of that, we'll be having more collaboration with complementary fields. So looking outside of our bubble. That's what our panel was talking about this morning. So disability forums, for instance. So some positives, but actually lots of risks here. So there's concern that progress in the past 20 years was partially driven by a general trend towards fairness and equality. And unfortunately, there's been a recent backlash to this trend with the rise of more selfish attitudes. As healthcare resources continue to shrink and society becomes a bit less caring, the expensive treatments for rare diseases are less and less likely to be made available. Compassion fatigue may set in, as rare disease patient groups ironically get better organized, better resourced, there's a risk that the public could become disengaged. And there were also quite a few threats perceived here or risks around the rise of more precision medicine, precision public health, that actually rare diseases, and again, the panel talked about this morning, as more common conditions are broken down to more distinct subtypes, that rare diseases are going to get a little bit blurred, they're going to get mixed in with everything, and that we're going to lose what makes rare diseases unique. And there's all sorts of quite specific consequences of that around, for instance, national plans and strategies getting less and less attention, less and less funding. So if you could start to vote, some of you have already. So how important do you think this trend, threats to solidarity, equity, and prioritization of rare diseases, how important will this be in 2040? So keep going. And we'll go to 3, 2, 1. So almost half, 46%, went for critically important, and 36%, also big, went for very important. So what about our predictability? So how predictable do you consider the evolution of this trend to be? So how predictable do you think it's going to be that actually we're going to increasingly face these sorts of threats, that the rare disease cause, for all the different specific reasons I mentioned, is going to somehow come under threat? If you keep voting. And we go for 3, 2, 1, and close. Split again. So we've got the sort of outliers. So 31% went for partially predictable and 31% went for mostly predictable, with a little bit all around, but very, very few of you went for fully predictable. So I'm going to ask Anna Cole to make a really quick comment on this one, or how you voted.
Yeah, so I think I wanted to pass on one of Milan's comments just recently, that we need to consider in some of these votings cultural differences and probably differences in terms of stakeholders. So he just kindly sent me a nice trend of forecasting types of exercises between Americans that voted everything was awesome and Europeans who were more on the pessimistic point of view. So perhaps there's some cultural differences in the room. But in terms of solidarity, I won't repeat everything that was mentioned on the panel this morning. I guess my main concern or comment is, okay, we're all clear that this is a very critically important but unpredictable trend. My worry is that we don't necessarily have any really answers about how to change that. So I think all I can offer is the idea that it happens at the individual level. And certainly from Eurydice's point of view, we're taking into consideration how much stronger of an alliance we need to be. We talked about that yesterday in terms of our national alliances, but I encourage you to do the same thing with your stakeholder groups.
Yeah. Thank you very much, Anna. So we will go for trend number 6. We're getting there. So trend number 6 is increasingly empowered rare disease patients and the patient advocacy evolution. So lots of opportunities here. Citizens increasingly, wait till I finish summarizing before you vote if you can, because that way you'll know the kind of things that you all said that come under this. So citizens increasingly feel that they have the right to be part of society, despite the fact they have a rare disease. That sounds silly, but it's fundamental. People are exercising more and more their civic rights, and they have more of a collective identity around advocacy. Got changing roles of patients and families and patient organizations to drive health literacy and enable navigation of complicated health systems will open up access to some health services. We've got more patient-centered care, patient democracy is continuing to rise. People are complaining if their healthcare services are appalling. They're not afraid to speak up. They demand what they want. We don't always get it, but we try. In terms of concrete activities around patient organizations, we envisage an increase in the number of patient organizations and also in their organizational capacity. For some countries, the scope of those organizations may broaden. As I said earlier, they may collaborate more with groups like disability forums to be stronger together rather than look at the differences. We'll see a continuing shift in the way in which patient organizations come together. So people envisage fewer face-to-face meetings and more virtual meetings, more virtual communications. We should think about what that will mean. And also that the methods for engaging younger demographics will also change. The younger generation more and more are on social media than we are, so we may have to think about how we accommodate that. Quite a lot of trends. This was actually a really broad, again, if you read your fact sheet, this is a really broad one around patient empowerment. There were quite a few trends here around data and an increase in the volume of patient-generated data, the feeling being that if patients are generating the data themselves, you have more control over it, you have more control in being able to share it. We get better use of apps, mobile devices, better understanding of the real needs of patients. So that was really the focus here. We get a growing emphasis on collecting patient-relevant outcomes, whether it's for clinical trials or studies, and also more educated and more capable patient advocates being brought in more and more to health technology assessment, where they're absolutely crucial. Some of the risks, because there's always the downside, a few of the panelists foresee increased competition and tension between patient organizations as resources, funding gets more and more competitive. So that's a negative. And also people felt that that divide between patients and professional patient advocates, for many reasons, is going to become more and more broad, and that has a real effect on the community. There was also a concern, again, related a little bit to the precision medicine and personalized healthcare. Sorry, more the precision than the personalized, because they're different. Is that the advocacy, the identity of rare disease advocacy will change. Again, we have the compassion fatigue comment that actually, as we get really well organized, well-resourced professional patient organizations, the public might lose interest and we're not going to have the public support we've had in the past. So a whole range of different topics around this one. So let's open the voting. So how important is this trend going to be in 2040? This is around increasingly empowered rare disease patients and the evolution of patient advocacy. So if you vote now, and we will close in 3, 2, 1. Okay, so we've got the most popular one there is very important, but again, critically important is not far behind. Unsurprisingly, very few of these have been rated as lower importance. Let's go for our predictability question. So how predictable do you consider the evolution of this trend to be in 2040? And again, when you're answering this, think about, is this trend really susceptible to external changes? Could things come in and really change the course of this, change the way in which it's going to evolve? So if you vote, and we'll close voting in 3, 2, 1. So that's interesting. So actually, we've got mostly predictable as the most popular answer here. I think I'm going to go for Anna-Cole again and ask what you think about this and how you voted.
I guess, yeah, it goes along with these votes. So I'm obviously pleased to see that it's highly important, and I suppose pleased to see that it's mostly predictable. As Giovanna mentioned in her slides, this is now a mainstream trend, if you will, to include patients in all facets of healthcare and delivery. I guess I would just underscore the fact that we can't be victims of our own success, and that we certainly should be wary of the fact that civil society needs to be taking care of themselves. So if I can just maybe include one of the more recent comments around this theme, which is that we have more and more foundations, more and more foundation support in this area, and that's a great thing. We need to be wary of the fact that patients are expected to be responsible for their own health. So it's an encouraging trend, but one that we need to be cautious of as well.
Yeah, a bit of a double-edged sword there. And again, all of these subtleties. I know that when you were responding to the Survey Monkey, a lot of you recorded these kinds of comments and these sort of qualifiers. But if you haven't had the chance to do that yet, then you can do that this afternoon and also in the days following. Because, yeah, very, very rarely are any of these future trends really straightforward and black and white. Okay, we'll move on to our next one. So this is trend number 7. So this is the rise in innovation-oriented, multi-stakeholder, needs-led, especially patient-led research. So that's quite a mouthful. So what do we mean by this? So here, our panel suggested, you suggested, that there'll be more research on some of these hitherto neglected areas of research, so more innovative research based on patient needs. So more research on the social impact and on the burden of illness of rare diseases, that we'll have a better understanding of what the needs of patients are by a greater volume of patient-generated data. We will have a better understanding of the epidemiology, natural history, and daily impact of rare diseases, and that this in turn will support, and again, we've heard this in some of the other trends, this will support the identification and the use of more relevant and more feasible outcomes for clinical research. So again, quite a few of these trends refer to the development and the embracing of more appropriate patient-relevant or patient-centered outcomes. There were some interesting specific trends around the design and execution of clinical trials and studies in the future, which is expected to change. So we'll have more decentralized trials on a smaller scale. We'll have the emergence and the use of new methodologies for clinical trials, and also use of more agile personal health records or apps to help reshape the design of clinical trials and clinical studies. The trend for patients to not only fund, but also to really shape research came across really strongly, that increasingly we expect more co-creation, more patient partnerships to develop things like registries, but also to design and conduct research. So not just coming in at the end, but actually shaping it from the beginning. And we had some nice examples in our panel of some really innovative ways in which actually patients are going out there and in fact, getting their own medicines, developing their own medical devices. They're taking this into their own hands. And then a slight shift, thinking about research more broadly, quite a few people in the panel felt that actually the traditional model for rare disease research is really not working. It's not getting us where we want to be. So a significant paradigm shift is going to be necessary. So again, a couple of the specific comments here. There'll be a rise in translational research enabled through academic-initiated and multi-stakeholder collaborations. So not just industry alone, but actually industry partnering more and more with the different stakeholders. We will see increasing collaboration with actors from so-called external, but very complementary fields, including e-health, big data, omics, for instance, genomics, metabolomics, bioinformatics, to explore new avenues for research. And again, less traditional tech companies are going to enter the rare disease space more and more, which may see entirely new approaches to bringing drugs to market. So that is your lightning fast summary for this one. So if we can start the voting. So rise in innovation-oriented, multi-stakeholder, needs-led, patient-led research. So how important do you think this trend is going to be in 2040? So if you can vote now. We'll close it in 3, 2, 1. And let's see what we get. So again, the most popular answer is critically important. So in total, 75%, this is embarrassing, 75% of you voted either critically or very important. So what about the predictability of this trend? So how predictable?
There's been an illogicality in the responses on predictability. There is also an illogicality in that order, because predictable means predictable. So we need to insert fairly predictable, reasonably predictable. Fairly predictable, reasonably predictable. And it's also unfortunate that you said don't keep doing 3, because now nobody's doing 3. And the results are clearly distorted.
Yeah. By the don't keep doing 3, obviously, if you think 3 is the most fitting answer, that's what you should go for. But I agree. Any comments, Giovanna or Andrea, on the wording that we've used there? Of the scale?
Means the same as fully predictable. So it's wrong in the order. It needs qualified.
Yeah.
More qualification
On the negative end, yeah.
So it's
we
a
should have
semantics thing.
completely unpredictable, partially unpredictable, then predictable, and then fully. It's just a matter of scale, yeah.
We have used it before, and it worked, but we can take in consideration the comment. So maybe also in this case, we never had so much, let's say, grouping as a very important, and they are the trans, I don't know, maybe it's also a way we formulated and are shaped, it seems all in the 3 level and all very important.
Yeah.
So
So-
it's much more trickier than exercise we have done before. I don't know if because we have chosen some trend or formulated in a way that are already in the card, so or there is a question of doing a foresight exercise where there've not been so much discussion about the future, so there is more difficulty on entering on what does it means, and it's also could it be that the formulation how is expressed in the survey was not direct enough. So I think there are different reasons behind the fact. We will show at the end what we received from SurveyMonkey, and we have a group.
Yeah. I mean, we should have probably called that something like averagely predictable would have been more. That's the way I read it, given that it's in the middle, is that it's that midline. But that's a really good point, Russell. The semantics in these things is, can be improved.
I just wanted to add that, so this afternoon we'll have the opportunity to kind of rediscuss things again, and that was the intention of having this live vote, is to get your feedback on what the actual experience in SurveyMonkey was. So if you want to change your scales of predictability, then this afternoon will certainly be the chance to do it.
Okay, so let's see what the results. We close that one in 3, 2, 1. So our most popular is partially predictable, but not by a huge margin. Mostly predictable, so somewhere around the middle. So who am I going to give this exciting interpretation to? Lucia, could you give us a fairly succinct but expert comment? No pressure.
Yeah, so I'm totally aligned with the outcome. I think that it is critically important to take care of all of these factors, and they are already being taken care of, because these are enabling factors for success of any therapeutic approach or treatment approach. More and more we have examples of failures that are due to the fact that not all of these components have been built in the process or in the design, and more examples of successes where all of these or most of these have been factored in. The patient participation, the design of clinical trials with the small numbers of patients involved are we cannot do without that. So and it will be more and more powerful, these thanks to the inclusion of those elements like big data, the omics, bioinformatics that you mentioned. All of this makes this all fairly predictable, because I think we are moving along this trend already now, and it will get stronger and stronger, but luckily I see it happening already.
Good, that's a nice positive note, Lucia. Okay, we're going to go on to trend number 8. We're getting there, I promise. So, facilitation of knowledge exchange and local care delivery through digital care. So we talked quite a bit in the panel this morning about digital care. So opportunities here, we had a lot of discussion, lots of specific future trends that you identified around virtual care. There was a lot of hope, particularly invested in the ERN CPMS, their clinical patient management system, and how that's going to evolve and improve in the future. Telemedicine tools generally will become more widely used and more important, especially for separated, geographically distant rare disease communities. Also, more opportunities envisaged for patient participation to certain aspects of these virtual teleconferences, including CPMS. Alongside the wider use of e-health tools, the panelists predicted more favorable digital healthcare environments. So an increasing drive towards interoperable e-health systems and more potential to extract data, meaningful data, from electronic health records. Again, we've mentioned this previously, as part of the facilitation of knowledge exchange, we see a greater volume in the future of patient-generated and therefore citizen-controlled data. So more e-health tools in the form of personal health records actually available on your phone, more personal health devices will give you better data, but also make it easier for you to take that data to your doctor and to allow them to give you the best possible care, not based on several weeks or months of lag time, but on what's been happening to you in the recent days and hours. Some of the risks, if we're talking about better virtual care, better movement of data, better access to apps and use of those for your care, we have to overcome some issues around privacy and data protection. So again, some of the specific risks that you highlighted here was that patients may, I would possibly say will, be less willing to donate or share their data if they're not certain who's going to own it and who's going to be able to access it and use it and for which purposes. So that lack of clarity is a concern. Also, consent models and GDPR is really important here, of course, if you're thinking about extracting data from apps and electronic health records. And another specific trend here, which was seen as a bit of a risk, is that countries will continue to diverge in terms of their models of consent for clinical data sharing. It's great. I remember the particular people who came out with some of these things as we go through them. Okay, so that's a really lightning fast summary of some of the specific comments under this trend and what we meant by it, or what you meant by it. So let's open up the voting. So how important do you consider this trend to be in 2040? So facilitation of knowledge exchange and local care delivery through digital health. So if you can vote now. And we will close in 3, 2, 1. And the results, so the most popular answer is very important. Critically important comes just after. Okay, so what about our predictability? So how predictable do you consider the evolution of this trend to be in 2040? So in other words, is knowledge exchange and local care delivery really going to be facilitated through digital health? Is that pretty certain, or are there all sorts of factors that could affect that? So if you can vote to the best of your ability, and again, we will try from now on to use C as being sort of averagely predictable, middle level predictable.
Yeah, maybe also what could help is thinking this layer of European. So, because I think one of the why we have such a different, one of the reasons why we have such a different.
It's on mute.
Okay.
Okay.
Hello?
It's on mute.
No,
I
it's
just
on
have to
mute.
click this.
One of the reasons why they were so much contrasted between the third and the fourth is because, for example, in some cases you think globally or the European, or you think local and European. And healthcare, especially, is so many different regional and national and European level. So remember the question that the territorial landscape, we want to move the policy recommendation and the scenario is the European one. So it's not so much about to what extent this trend is at your regional level, but to what extent it can be amended by European policy. And so the predictability have to take in mind this in the background. Maybe that could
That's a good point, actually, and we can capture that in some of the comments this afternoon. And indeed, we did do that a bit in the teleconferences, because it might be that for one country, I don't know, maybe one of the, Portugal or the Scandinavian countries, Latvia, that this is a lot more likely to happen than some of our other countries. My hospital is entirely paper-based still, actually. Might be in trouble for saying that, but it's largely paper-based. So actually the likelihood of this developing with certainty in the timescales we're talking about might be different than for some of your countries. I don't know what's going to happen in my country, frankly, quite soon, so it's not a good example to use. Okay, let's close the voting in 3, 2, 1. Oh, we closed, right. So here, most popular was mostly predictable, with 43%. Okay, I'm going to ask Maurizio if you can very quickly give us a quick insight into why you think the vote went that way.
I think that I don't want to repeat what you said. Of course, I mean, if we go on the 2040, we hope that everything we have now, which is embryonic, in 2040 will be operational. So the CPMS, for example, now it's really very difficult to use because there are still some reluctance from hospitals, local laws, or whatever. We hope that the CPMS, which is this platform to share all the data, will really be more facilitated. I hope that there will be interoperability. Now we need to have interoperability, a change of mentality. At the moment, still now, everybody is doing his own registry, his own databases inside, his own computer. Into 2040, of course, this will be important to do. Then regarding the increase of generated data from patients, in 2040, of course, we will have patients who will grow inside a computer-driven life, which is not the patient we have now because they are born 20 years ago where we started to use medicine with computers. So I think that this is really an evolving field. What it is important for the hospital and for the physician is actually to be helped by bioinformatics people, by specialized people, because we don't have the training. And we are dealing with big data that even now inside the hospital, we don't know how to manage. Even all the exome data that are generated for diagnosis are very difficult to unfold. So we need help to insert in our hospital, in our teams, new figures. And this, I think, is the major challenge for the future, to have someone that is helping us and the patient to really use these kind of tools.
Thank you, Maurizio. That leads us very nicely. Actually, our next two trends are really quite data focused. And again, this is worth thinking as we go through, are there some complementarities? Are there some overlaps if we want to sort of combine some of these? Maybe, maybe not. So trend number 9 is increased potential for large sets of standardized and interoperable data. So loads of opportunities here. And if you're interested in data interoperability stuff, I would really read some of the Google Docs documents because some really nice comments. I'll give a very few examples because we're getting a little bit short on time. But as I said earlier, we've pushed the lunch back a bit. You get the same time, so we're not running too late. Okay, so some opportunities. More widespread and pooled data from genome-phenome correlation studies will accelerate the pace of diagnostics. Better understanding of natural history of more rare diseases by global federated registries and from better use of unstructured data. So actually we had quite a few specific trends around patient registries. From a basic level, we anticipate, or you anticipated, some of you, that there will be more patient registries collecting broader data sets and quality of life information, which will more clearly illuminate the problems and needs and challenges of people with rare diseases. Same time, there may be a move away from centralized, vast mega registries. We are more likely to see registries sitting within a wider data ecosystem of sources which are separate places, but are somehow able to speak to each other. And another one specific, we will see real and intensive use of data searching, data finding by the European Rare Disease Registry platform. There were lots of discussions around fair data principles, way to make data more searchable, more queryable, more interoperable. An important point here about looking beyond our own silos and our own backyard. So we will see a greater harmonization in the use of coding ontologies and more strategic and widespread use of standards and ontologies which are not specific for rare diseases. And that's really important if we want our data to be able to speak to data, for instance, in hospital systems and EHRs. We can't go one way as the rare disease field and everybody else goes a different way. Again, doing all of the above will involve increasing collaboration with actors that in the past we perhaps haven't worked with so much. So people from e-health, big data, again, the omics field, bioinformatics. A few of the risks here, to obtain the full value from the different sorts of data sources we're going to have, some degree of interoperability between these, so between resources like registries, biobanks, electronic health records, will be necessary. So generally the risks here, I think, were that people were not convinced that this interoperability will exist, and Anna will probably have a nice comment to make on this. Again, we have issues around the patient privacy and the data ownership, that patients may be less willing to donate or share their data if they're not certain who's going to be owning it and who's going to be using it. An important point around the skills gap and the personnel, so a different sort of trend here, is that being able to work with and pool and interpret and manage mass amounts of data pooled across different resources demands an expertise that people like me certainly don't have. You need to have some sort of data management expertise. And there's a question about whether we actually have the people in place to do that sort of role. So that is a quick summary of some of the specific points under this heading. So if we can open the voting, how important do you think this trend will be in 2040? So how important will it be to have increased potential for large sets of standardized and interoperable data? Is it going to be really important, middle level important, not very important? So keep voting and we'll close the vote in 3, 2, 1. So we've got almost 50% went for critically, and the biggest one by far after that was very important. Okay, question about predictability, uncertainty. How predictable do you consider, I keep reading the questions, but you know them by now. How predictable do you consider the evolution of this trend to be at 2040? So how sure are you that we are indeed going to have increased levels of interoperability, increased sets of interoperable standardized data? Do you think there are many things that can affect whether that comes to pass or not, or are you fairly confident this will happen? So if you can keep voting, and we will close the voting in 3, 2, 1. So let's have a look at the results. So mostly predictable this time. So 35% went for mostly predictable. And then we had 22% went for that middle level. And another 22% went for partially. So kind of clustered around the middle options. So I'm going to ask Anna Rath if you can make a nice, succinct and very expert comment for us on these results.
No pressure.
No pressure again.
At all. I'm trying to be short because I think that there's no doubt that there is a great potential of having data, but I will add good quality data. And that is when things are less simple and less predictable because we are really relying a lot on techniques. And I will say that now, and I will say that later, there is a human factor. So I think that yes, it's mostly predictable that this trend will continue to evolve in the right sense because there are already a lot of international, not only European, but international efforts trying to make data more and more interoperable. And even if it is not fully the case now, the trend is there, and I think that is unavoidable in the future. But we still have the problem of the legal interoperability. And the legal interoperability is one of the major challenges for that trend to be fully effective, as well as, I will say, the institutional interoperability, that is the internal rules in hospitals, in registries, in countries for data sharing. However, I think that one important topic to address in shaping the future is to realize or to acknowledge the fact that having good quality structured data, interoperable data, costs money and needs competencies. And again, it's a matter of human factor, training, and allocating money to make the data good data from the beginning. And that is, I think.
Thank you, Anna. And I think you've really exposed there some of the subtleties in this. So I think probably, all the partners are well aware that the wording that we've used for some of these can be a bit oversimplified. It can look a bit black and white. The reason for that is that they're sort of guides towards the topics that are going to be most suitable for policy scenarios. But underneath that sits so many levels of what's the right word? Many layers of details and different subtleties and interpretations. So one thing depends upon another thing. So this is really where we need your brains this afternoon. Okay, number 10, trend number 10. This is the rise in the use of artificial intelligence, AI, for diagnostics, treatment and care, opening up the potential of big data. This may be controversial because one important question here, as we discussed, is what actually constitutes big data in the rare disease field. So generally speaking, individual registries, even maybe clusters of records, probably wouldn't count. Maybe linked data sets, giving you federated access to many different individual records or data entries, that might qualify more. So what did you identify as specific trends and opportunities here? You saw increasing use of artificial intelligence on data sets for clinical care and research purposes. AI will enable rapid access to all types of information by non-experts, and it will free up doctors' time by handling routine activities. This is really interesting given some of the discussions this morning about the need for computers to not replace the human and the human insight. Again, if this trend goes anywhere, we need to have increasing collaboration with actors from complementary but external fields. Again, big data, e-health, of course. We foresee, or you foresee, some of you, better digital biomarkers, endpoints, outcome measures, and real-time analytics supported by machine learning. There was a particular angle of trends or a particular group of sub-trends here around the potential for AI to support the better identification of target compounds for rare diseases. And that this is going to be more likely by the entry of these less traditional, more disruptive actors, tech companies into this sphere that are going to help us, hopefully, in bringing drugs to market through different routes. Interestingly, the panel also brought this back to a really human aspect, so not just about drug screening and selecting better molecules, but actually that AI could help people with rare diseases to live more independent and autonomous lives. So here we had rise in assisted tech and supportive devices generally, particularly through AI, will improve the quality of life for people with rare diseases. The risks, again, to be honest on this one, were very much around, or at least the risks that you identified so far, are very much around the privacy side. So the use of artificial intelligence for diagnostics, for treatment, for research, is perhaps not widely understood by the general public. And it's important, or it will be important, to reassure citizens that contributing your data to any resource that is likely to undergo AI analysis doesn't leave people vulnerable to exploitation or abuse. And again, a final concern that in some quarters, many rare disease data sets will actually just remain too small or too unconnected, too fragmented to really allow AI to provide significant value, because that's how the machines, sounds very Terminator-esque, but this is how the machines learn, is actually they have a bigger data set, they can understand patterns and make the connections. Okay, so that again is a summary of what we had as specific sub-trends under this one. So let's open up the voting. How important do you think this trend is going to be for the rare disease field?
So sorry.
Oh,
All good.
what?
Yes.
Okay.
Now yes.
Okay. So how important will this trend be 2040, looking for the rare disease field? So if you can vote now. And we'll close the vote in 3, 2, 1. Okay, and by far the biggest group is very important. So not the critically important, that was 18%, 44 came in for very important, and 21% of medium importance. So let's look at the predictability, the uncertainty question. How predictable do you consider the evolution of this trend to be at 2040? So if you can start voting. And if we close the voting in 3, 2, 1. So the top 2 answers are either unpredictable or partially predictable. So that is interesting. So I'm going to ask Charlotte V, if you have a comment either on the results or on how you voted.
Well, I've been asked to comment on something of which I'm pretty agnostic, to be honest. To me, AI is a bit like Robert's machine that he mentioned this morning that can give all sorts of answers. I think the main issues that were already mentioned by Maurizio and Anna just now are about the big data, data linkage, the quality of the data and the data management, which obviously would be preconditions for even being able to use artificial intelligence, as far as I know. In terms of the voting, I'm very surprised that you feel so confident about voting about the predictability or unpredictability of this trend. Personally, I don't feel that I'm confident at all in terms of saying anything about it. I just wonder if there were a do not know option amongst these response options, how many of you would have chosen that one?
There was an opt-out.
Yeah, exactly. And I assume that if you don't raise your hand, then you feel pretty confident about being able to say something about the predictability of artificial intelligence to the residents. Okay, well, that's good. I think we know that, at least for interpreting the results.
I think Milan's comments this morning about some of the dangers where actually if, some of the algorithms are wrong or they're based on poor quality data, then actually the effect of that coming out the other end can be really quite disastrous. Okay, last two. We will go through these two even faster. So trend number 11 is around new technologies and advanced therapeutics. So unsurprisingly, given that only around 5% of our diseases have any dedicated therapeutic intervention, there are high hopes for technological advances and the launch of advanced therapeutics. So people highlighted things like CRISPR, gene editing. So some specific future-facing trends here. The panel anticipates more of these. That's quite obvious, but important. So more launches of advanced therapies and devices. Increasing emergence of gene therapy. So a really important kind of precursor or pre-step to make these new sort of technologies available and to advance the development of advanced therapeutics for rare diseases is to have a better understanding of the conditions themselves and to understand the mechanisms behind different developmental, functional, and degenerative rare diseases better than we do at present. So positive things here was that the panel foresaw better understanding of the natural history of more rare diseases through the global federated registries and from better use of unstructured data, and also greater tooling and resources to help doctors and researchers collect and use coded computable phenotype data, leading to more accurate and more numerous diagnoses. The panel foresaw particular benefits for artificial intelligence here around drug screening. We talked a bit about that last time. We'll continue to see limitations. This is an interesting one. We'll continue to see limitations in the interventions that we have for rare diseases. So we know that some conditions will never have a gene therapy. So the panel predicted that we'll see more emphasis on creating smarter technological tools and devices to help people live with the conditions and to alleviate disabilities and support the patients. There were a few specific trends here around new and innovative ways of conducting and funding research that will help us get this paradigm shift around therapy development that we mentioned earlier. So open platform research could change the medicine's development game significantly. Again, we've got the less traditional tech companies entering our space, and we've also got patients continuing to drive innovations themselves around devices, medicines, and aids to everyday living. However, an interesting point is that the panel felt that new technologies and advanced therapies will need to demonstrate their value more clearly than ever before. And this relates to that drive towards performance-based approvals and access models. The big risk here, to be honest, that people identified was that the areas, just as with ordinary medicines development, when it comes to advanced therapeutics, it's going to be the areas that already attract the pharma attention and the R&D, the ones that we know more about, what's causing them. They're going to continue to get most of that investment and most of that attention. So we're going to increase that gap between the diseases that have fancy new therapies and the conditions that have nothing. So that was a little bit the headlines under that particular one. So let's open our vote and see what you think. So what is the importance, or what will be the importance of this trend for the rare disease field in 2040? This is new technologies and advanced therapeutics. So we'll close the voting on how important you think this will be in 3, 2, 1. So that's, I think, one of the strongest that we've had, actually. So 57% of you went for critically important and 35% of you went for very important. So second question, predictability. How predictable do you consider the evolution of this trend to be at 2040? And again, there are subtleties, I think, in the title of this one, but we can delve into this more. So in the afternoon, one of the activities is that each of your groups is going to have one of these to look at. You're all going to look at all of them to a lesser extent, but each group that you're split into is going to look in real detail. So there's something here for the group who has this one, I think, perhaps to talk about the title and what that might mean. So let's see what you think. Let's close the voting. 3, 2, 1. And it's fairly split. So the most popular is mostly predictable, but we've got pretty reasonable proportions going for the middle line and going for partially, so kind of all over the place. So I'm going to ask Lucia to give us your insights as to why you think this has come out as it has.
Yeah, so of course, I'm very glad that the importance came up as probably the most important topic that was voted. Of course, we all are aware that innovative research is the basis to provide solutions to more and more diseases, with all the caveats that you have highlighted and the panel has brought to attention, of course, of inequalities, the caveat of a gap between diseases that are studied and overstudied and diseases that are neglected and run the risk of being even more neglected. And I think that the key factor here is to allow more and more research, and that means research investment on finding and studying the disease mechanism, because that will provide knowledge that will allow applying advanced technologies to those diseases that today have no solution, because it is still not known well enough how these new technologies can be applied. And I'm totally in line with the comment that not all diseases will be suitable for gene therapies, but there is research that should bring and will bring solutions also through small molecules, through repurposing, and through devices and other approaches. Regarding the predictability, it is of course predictable that this trend will grow, or let's say we hope so. But if we look into the first item that you mentioned, the CRISPR technology, this is something that was totally unpredictable. And if we think 20 years back, there have been so many quantum leaps in knowledge, technologies, and approaches that nobody would dream of or imagine before they burst onto the scene, that I think, and I'm very optimistic that there will be more quantum leaps that are making this field still quite unpredictable today.
Yeah. Thank you very much, Lucia. Our panel of partners are really, I hope you agree that our Rare 2030 partners have to work pretty hard in this project. We expect a lot of them. So we're on to our last trend, and then we'll have a very quick sum up from Giovanna, and then we're going to go for lunch. So last one. By the way, the order of these is completely random, so it's last but not least. So this is trend number 12. And this is around the application of whole genome sequencing from the research to the clinical sphere. I have to point out here, actually, in people's specific future-facing trends, we tend to move around between whole genome sequencing specifically and next-gen sequencing technologies generally. So there's not such a distinction. Okay, so our panel anticipate more widespread and pooled data from genome-phenome correlation studies. It's going to accelerate the pace of genetic diagnostics. That's a nice, concrete future fact, we think. Greater tooling and resources will help doctors and researchers to collect and use coded, computable, so understood by machines, phenotypic, so clinical data, and that is also going to lead to more accurate and more numerous diagnoses. Again, some of these may be obvious, but I think they're important to highlight. So we see that the cost, or we expect that the cost of genome sequencing, genetic testing, will continue to decrease. I anticipated going into this project that everyone was going to say that within 10, 20 years, in any of our countries, you're going to have your genome sequenced the second you go into your frontline hospital. Our panel said, no, that's not the case, or at least not everywhere in Europe in the timescales we're looking at. That it's going to increasingly be used for diagnostics in the clinical sphere, but it's not going to be truly frontline, at least everywhere, not in the next 20 years. So that's interesting. A major opportunity that was associated with this trend is, of course, the growth in more personalized medicine. So as we understand people's conditions better, we understand their outlook, more emphasis will be placed on actually preventing the symptoms from developing at all, where that's possible. So care will not only focus on patients, but also increasingly on healthy mutation carriers. Next generation sequencing techniques will have a major potential in the field of preconception and prenatal diagnostics and screening. So as that is increasingly made available in the clinic to patients, foreseeably they will have greater reproductive choices. These sometimes raise, in fact always raise, a host of quite complex ethical, legal and social issues. So all the kind of prevention issues come under this topic as well. Some particular concerns from some of you is that clinical services for next-gen sequencing diagnostics will continue to be underfunded for the roles that they are increasingly expected to play, especially compared to research. There's an issue around skills again, and the fact that there's likely going to be a shortage in terms of data experts, people who are actually able to read and interpret and manage the sorts of data that we're talking about and the quantities of data. And again, there was little expectation that some of the challenges that people see today in terms of understanding significant variants and pathogenicity, there's little chance that that's going to go away. So the accuracy of actually getting a diagnosis and interpreting the findings from all of these technologies will remain quite challenging for most conditions. And lastly, there was a lot of concern that the LC framework, the ethical, legal and social issues, those frameworks are not really there to incorporate this properly in most of our countries. There's also a logistical and operational concern that next generation sequencing coming into the clinic is going to happen faster and stronger in some countries than in other countries. So that's going to lead to more and more disparities, sometimes within countries, but certainly between the countries. And actually that potentially, as well as impacting negatively on patients, it could also push patients more and more to take a hands-on role in trying to find a diagnosis for themselves, going through private companies, and we've seen this more and more. You can say that's a positive, but that can also place people at a greater risk of exploitation, and it can deprive vulnerable people of the need for expert counselling and proper support to help them deal with the results that they're receiving. And it's also, if we have a lack of regulation around genetic testing in private companies, it's going to continue to place more and more sensitive data in the hands of big companies. So this is quite a loaded one. So the last vote before food. Can we open the vote? So how important do you think this trend is going to be for the rare disease field in 2040? So the application of whole genome sequencing from the research sphere to the clinical sphere. Is it going to be really important, middly important, not important, or any of the in-betweens? So let's close the vote in 3, 2, 1. So again, we've got pretty strong results favoring critically and very important. And let's do our predictability. And again, this is difficult. If you try to think of the predictability on the European level and not in your own country, but again, do bring in these subtleties when we're in the afternoon sessions. So how predictable do you think the application of whole genome sequencing from the research to the clinical sphere is? Okay. And we'll close the voting. And again, it's the predictability of the evolution of the trend. And we'll close the voting in 3, 2, 1. I feel like the Eurovision Song Contest here or something doing this. I could go for a change of career. Okay, oh, why are we on important still? Oh, guys, we were doing so well. Why are we showing the important screen? Is yours showing the right screen?
I'm sorry, it got moved, yeah.
Okay, so the most popular answer here was mostly predictable, but it's actually, again, pretty split. That's probably one of the most evenly distributed spreads, I think, that we've seen for the SparkUp tool. So I'm going to give Anna Rath our closing word on this one.
Yeah, and unfortunately, is the one of probably the not the right person to talk about, but at least I think that as in the other data-related and technique-related topics, technique is moving faster than the human factor, let's say, and that these technical opportunities are becoming cheaper and cheaper, except for the fact that the interpretation, the price of the interpretation is never taken into account when we are talking about the cost of next generation sequencing techniques. I think that is a trend that is already there, but that appeals for a international level collaboration in order to generate data on the interpretation of variants, on pathogenicity of variants. And this interpretation that is a collective endeavor should be capitalized in a way that it is usable. And I think in that case, artificial intelligence could really play a role in helping interpreting further in the future results of next generation sequencing. However, for that, we need also good quality phenomics data. And that is generating enormous amounts of genomics data, but phenomics data is a little bit behind. So, and that could hamper the interpretation capacities in the future, but I think that is another unavoidable trend.
Yeah. Thank you very much, Anna. Can we have a quick round of applause for my panel of partners, please? Okay. Do we have time for one quick comment from the audience on that one? So, yeah, very quick. Biruta, yeah. Has someone got the microphone for Biruta?
Sorry. Is it a closed list of trends? Because when I got the second one, it is about economical constraints. It has almost nothing to do with the second part of this question. Sorry for that, because it has much more branches about it. And I stressed also on teleconference about it is a global trend across medicine, and actually we have a huge waste of spending across all medicine, and as a measure for it, for example, pay for quality but not quantity. In rare diseases, it is also so important to tackle that enormous wasteful spending. So I do not see anything here, and is it possible
Totally
to do
agree
anything?
on that. So we can certainly change the titles of these, and also, I mean, the specific future-facing trends that people identified on the teleconferences, we've mapped them underneath these, but that's not to say that that's all they can encompass. So for me, actually, that trend number 2 is much more, as we currently have it, is much more geared around the importance of integrated, holistic, person-centered care and the growth in that, and it's less on the economic. There are much more complex issues at play. So the group that has this one will have some work to do. But no, the answer is, we're hoping not to generate brand new overarching trends, but we can rename them and we can shift the focus and we can talk infinitely about what comes underneath each of these and what the extremes of different developments would look like. So it's good that you have lots of questions, lots of comments, because the afternoon we have a 2-hour session where actually all of you are going to be put into groups. You have a little group number on your badge, which tells you what group you're in. And one of my colleagues in a second is going to tell you where the groups are going to be, because for 2 hours after lunch, and we'll keep that 2 hours, you're going to be working in smaller groups.
So if you could just
if
pay
I can just
attention
keep
for
your
a few more
attention just
minutes.
a little bit,
One
and then
piece
we'll
of
go.
practical info.
Okay. So we're going to be doing group work this afternoon. So thank you for contributing again to the Spark Up. The good news is that by now we won't need any introduction time for your group work, because even those of you who've never come across the project or the survey before should hopefully be really familiar with what these 12 overarching trends mean and what's currently there. So you'll be all ready to contribute. Giovanna is going to take 5 minutes of our time to share with you what the SurveyMonkey results came out looking like, and she's going to give you a little bit of intro for the activity she's planned for the group work in the afternoon. So Giovanna.
Hi, hello. I'm sorry to do this now because I'm sure you're all hungry and there was quite an effort. So I will try to be brief, just few minutes, apology, but I have a nice graph that actually showed the result of this SurveyMonkey. I could not update it with in time, let's say, on the spot, but we will compare the result. How? I'm also, maybe it's not. Yeah? Okay. So just a few, what we'll do this afternoon is look at the result of the SurveyMonkey. And you can also consider the result of the survey on the spot and compare. And the first will be the time for you to speak. This morning was very much like a presentation, but we really wanted a small working group to give the opportunity to all the speakers, to all the participants to have their say on what they think about the trends, how they are positioned in the graph, and how the title reflects if something is missing, and what should be the most important and certain trend for them. So the first half an hour or more will be discussing this, and we would like the group to create a consensus on the survey result, reviewing it. And then we will look at interrelation. We have prepared a graph to try to see how the different trends interrelated. And this means to also see if something is missing or something can be aggregated. The third part will be more a creativity exercise, looking how one trend can be developed in different, completely contrasted way. Is an effort of simplification that sometimes is also useful for them communicating a message. More is based on the analysis you know, on the knowledge you have. The simplification is really a strong way of, thanks. Sorry, I have a strong voice. Okay, these are the trends we have just seen. And okay, that was the very first result of the SurveyMonkey, not the one you have made today. There are just two axes, and the one that were voted actually won. We have elaborated on that. The first axis is about critical important. The other axis is predictability and unpredictability. As you can see, almost all were considered very important, critical important, but then there was not something that was highly unpredictable, more than. So we have done an exercise in few hours before because we closed the survey really. So for sure can be improved. But what we have done is just to, can you go on the next one? Just to focus on the upper. So this is just a focus on the upright of the result of the survey, and what the result, at least of the SurveyMonkey, and I think there was some shift on, for example, on artificial intelligence, at least slightly. What we can see that was what considered highly important and poorly predictable. So very important is innovation on healthcare research. So the question of transnational, how the collaboration open data or not, new way of patients engagement, co-design, co-creation. At the same time, we call it healthcare budget, but it was new delivery model. And so it's how the budget is actually allocated, how much the research for new delivery model is successful, new technology, so the trends about new research, and as well access to treatment. So this, let's say, if we move, can you show the last one? What we have done, and that is just an overposing some axis over the focus, build over the axis, just to read a graphic, not to move. And this, you will have a printout of this on the table this afternoon, so you can discuss and say, I do not agree, I think this should be on the quadrants. So I really like facilitating method more than, let's say, hard rock science, is a way of reading the result of the survey, of the SurveyMonkey, and stimulate the discussion and looking for priority. Say, I think on the top quadrants, there should be this trend, and this is the reason why. And all this reviewing together was also aimed to have a fruitful discussion in small group this afternoon. Then just to quickly and free you is this is the matrix. We will ask you just to work in the bottom of that to highlight how the trends are interrelated. You will have 3 dots and you all are connected with all the trends more generally. But then we will ask also here to make a choice and to spot those that you believe are the most important. I don't know, big data and artificial intelligence. I believe that one of these brings the other. So I will not build scenarios in 2 trends that actually cannot be very contrasted because they are strictly interrelated. So we will ask for other half an hour in a group discussion to review which for you are the strongest interrelation among the trends. And the final one, this is just an example. We, from Fresher, where we have completely different trends, we have just 2 similar, inequity and demographic change, to work on axis. At the end of this day, we were like this 12 trend, imagined with 2 different, and an easy way is imagine an indicator. Another creative way is to imagine a future, what could be, but there will be half an hour discussing what could be the axis, how you will call it, how could be the extreme. So if you have a number, it's easier. If you have an imagination and you give a picture, it's fine. If you want to do a different territorial scale, if you want to consider, there could be also opposite trend. At global level, we go for more integration, and national level, we see some contrasting. So there could be some discussion about territorial level and scale. So the last one is about the group and trend. So you have been assigned to a group that is written in their badge, to a rooms that is written in the door, and to a trend that I hope you like, and that was a bit the choice to have tried the group to develop all the trends. And then based on the interrelation analysis and the survey analysis, try to understand which one should be the priority. But no trends will be left, let's say. Okay, that's all.
Thank you, Giovanna. So I hope you enjoyed that exercise. It wasn't too frustrating. If you have questions about your group room, just come see me. Otherwise, they should be posted on a flip chart somewhere near lunch. Bon appétit.